What are some stresses and vulnerabilities that can contribute to delirium? In other words, why has the patient presented with these symptoms now? For the case of Mr. Anderson, which ones apply? The Australian Commission on Safety and Quality in Healthcare Delirium Clinical Standards identify key risk factors for delirium, which include age above 65 or above 45 for Aboriginal and Torres Strait Islander people, known cognitive impairment or dementia, history of delirium, severe medical illness, current hip fracture, and admission for procedure or surgery. Remember the phrase spot, stop, and treat as a practical way to approach delirium that might help you as a junior doctor to identify delirium early, communicate effectively to your registrar when escalating, and improve patient outcomes. Spot. Risk stratify the patient. Use screening tools within 24 hours of admission and pre-admission where possible, and complete serial 4ATs during the admission. Stop. Involve the family and patient for a collaborative delirium prevention plan, maintain the environment, provide familiar objects, review medications that may increase risk of delirium and discontinue where possible, and remove the IDC early. Treat. Investigate and treat the underlying pathology, reassess risk factors and modify where possible, avoid antipsychotics unless absolutely necessary, and then only with senior involvement. Start low, go slow. A great way to remember the common causes of delirium is the pinch me mnemonic. Presented on the screen is some relevant history that you've been able to decipher from the handwritten note completed by a busy surgical registrar on the night of admission 2 days ago. You look through the patient chart, medical chart, and familiarise yourself with their admission and what's happened up until this point. You look up their bloods and recent imaging, which are just x-rays of the fracture pre- and post-operatively. Consider the common causes of delirium and the pinch me mnemonic, which can be helpful. In the context of an acute event and hospital admission, always look at any new medications or opioids that may be contributing to the confusion. And finally, always look at the trends in vital signs for any signs of infection or sepsis.